guys, welcome back to my YouTube channel. Today's video is about speech and language delays in children. One of the main reasons I decided to do this video is because I've seen the anxiety that most parents experience when they've got children who have a speech delay. With me today to unpack this conversation is Rakgadi, who is a speech and language therapist. She obtained her qualification from the University of the Witwatersrand, where she is also currently pursuing her master's in audiology. Thank you so much for being here.
Thank you for having me, Didi.
Can you kindly briefly introduce yourself and also let us know about your professional interests?
So I'm a speech language therapist. I qualified from the University of the Witwatersrand. I'm currently doing my master's in audiology, which is focusing on oral rehabilitation. My professional interests include oral rehabilitation, of course, pediatric dysphagia, and language stimulation.
Okay. So, Rakgadi, I'm really hoping that this conversation will be insightful for a lot of people, because I, for one, am a parent who stresses quite a bit about my son. And I think any parent can attest to the fact that it can be quite stressful raising a child, especially when you start worrying about their milestones. And a lot of people say you shouldn't compare children, but when you're a parent and when you're in like a parent's shoes, it's hard not to, because if you've got, for example, a friend who is also a parent and their child is, for example, speaking way sooner than your child is, it's not an easy thing not to worry. And then you start thinking that there might be potentially an issue or something wrong with your child. So my first question is, since you're a speech and language therapist, what does that entail? And what are the differences between a speech delay and a language delay?
So I'm a speech language therapist and audiologist. To simplify it, we are communication therapists. So we rehabilitate the communication path between receiver and expressor. So if I struggle to express my message to you, whether it's speech articulation, whether it's language barriers, then we try and rehabilitate that on the expressor side. For the receiver, then we also work on comprehension skills, which is understanding the message the expressor is giving, as well as hearing. And then sometimes if a person can hear and they can't process it, then we also work on that as well. The difference between speech delay and language delay is, first, I think we need to establish the difference between speech and language. So speech is spoken language. Language is communication. You can communicate without spoken language, verbal language. So if you have a speech delay, that means you struggle with the articulation aspect of it. It's not to say if you have a speech delay, you have a language delay. You can have one, but you can also have both. A language delay, on the other hand, speaks to making the message, like conveying the message to you.
So putting the words together.
Yes, absolutely. So you can have a language delay, but have great articulation skills. When you have a language delay, then should I tell you how we see it?
Yes, please.
Okay, then we see it by a child who struggles to put a message together, struggles to express their needs and wants, whether it's gestural or verbal. What else? Yeah, that's all I can think of now.
So what are some of the reasons why a child might be late in talking? Because obviously kids reach milestones, but other kids, let's say, maybe take us through first the milestone charts that you think a kid needs to go through when it comes to speech or language. And then what are some of the reasons why some kids are not talking when they are supposedly supposed to be talking?
Okay, so according to how we expect children to develop with their speech and language is that they start with cooing and babbling at 3 months. So they start making sounds in an attempt to to make a little message, whether it's they need to be fed, whether they're hungry, whether they need that nappy to be changed. That also comes as verbal communication. And then they start making small sounds, sounds that we like mama, papa, pa, ma, but they're trying to create a word. And then as they get older, say at 1, then we expect them to have a first word that is intelligible, which means that you can clearly understand. So if their first word is mama, you should be able to hear it's mama. And then as they get older, we expect them to start connecting mama with another word that is also intelligible. So what the American standards are which is really not transferable to the South African population, and is something that we really need to be careful with when we advise parents, is that the Americans, which learn one language at a time, expect children at the age of 2 to be stringing 2-word sentences, at the age of 3 to be stringing 3-word sentences. But these are monolingual children. We have to keep that
When
in
you say
mind.
2-word sentences, what do you mean?
Mama, food.
Oh, okay.
And then 3-word, mama, I'm hungry.
Yes.
Those are 3-word sentences. And as they grow older, we expect the sentences to get longer, more complex and more complex.
And what do you mean by older? At what age?
So at the age around 4, we're not expecting so much 4-word sentences. Now we're expecting the child to be able to convey their message, they express their needs and wants, express conversations, be able to partake in conversations, have social skills in conversations, because communication is more than just like words.
Yes.
So at the age of 4 or 5, we expect them to be able to hold a conversation and have social skills around a conversation. The reasons why a child could be delayed in language most of the time in our population is multilingualism. Most of our children are learning many languages, and that bombardment of the language, where they're probably learning 3 languages, is a child still just trying to grasp which language they're going to be using to communicate the most. Furthermore, I could say that also we have neurological conditions that contribute to children's language delay, such as autism, Down syndrome. All of those contribute. So we have to be very sensitive when we say that our children are speech delayed, because it's not always the case. But if you suspect that your child is delayed, or you're concerned about their development in speech and language, contact your doctor, your pediatrist, or speech therapist. They'll be happy to help you.
You touched on autism, which is quite funny, because not that the autism itself is funny, but I'm a Google mom. So because AJ is my first child, any small concern I might have about him, I literally run to Google. And one of the things that I came across when I was trying to research whether or not he's going through a speech delay or what could be affecting his speech, I came across autism, and I started reading quite drastically about it. So do you want to maybe explain to parents who don't know what autism is, do you want to explain that to them? And what is the link or connection between autism and speech delay?
Okay, so autism is a neurological disorder. As far as I'm concerned, we don't know what causes this autism. There's no need for yourself to blame yourself for what you could have done better or what you should do better. If a child is diagnosed to be autistic, then you just need to cater to what they need. An autistic child, in simple terms again, is that a child is basically, they struggle to regulate themselves as opposed to a normal child. So they need increased sensory input or less sensory input. A lot of sensory input could be overwhelming, or little could be underwhelming, which would make them very restless, basically. Because of how their brain is wired, then sometimes a child who's autistic, depending on where they are on the spectrum, it's a spectrum, what to say, depending on where they are on the spectrum, they could even just not speak. Not because they can't, because they choose not to. So it's important for when your child gets diagnosed with autism, that you know exactly where on the spectrum they are, so that you can know how to stimulate them for them to reach their maximum communication capacity.
What would be some of the signs, early signs of autism in children, for a parent that maybe does have a child with autism but is not aware that their child might have autism? What would some of these signs be, and at what age should a parent start maybe considering getting their child checked for autism?
So a few red flags that I would look out for after the age of 3, I'd look out for these flags after the age of 3 would be a child who can hear but does not respond to their name, a child who avoids eye contact, and who have repetitive behaviors. These behaviors can include playing with toys a certain way, packing toys in a certain way, preferring certain toys over others, preferring to play with girls over boys, and lastly, behavior. Tantrums, unreasonable tantrums. We know terrible twos, but there is terrible twos, then you can tell that your child is just not stimulated well. those are what you should look
For
out
example, I know with certain kids who have autism, if you take them with you to the shopping center, because it's so loud,
Yeah.
they become extremely restless.
Yeah.
Or you see that when they are in a public setting, let's say they at a park with other kids, and you see they're not really engaging with the other kids,
Yeah.
and would prefer to just isolate themselves and sit alone. So I don't know if I'm correct.
No,
or if
you-
those are some of the signs.
Yes, you are correct, because a lot of times the children are, like public places especially, are overstimulating, and they just can't handle the stimulation of all of it. So when you suspect that your child is autistic, be sure to take them to a doctor so you can find out what's really happening.
Okay. So another, I think, concern or issue that might be causing speech delay in kids that I've heard about is tongue ties. I remember a few months ago I was sitting with my nail tech while she was doing my nails, and we were talking about this topic of speech delay in kids and when kids reach certain milestones. She mentioned to me that her child turned 3 and wasn't really speaking yet or saying much. She obviously started getting very concerned, and then her mother-in-law actually pointed out to her that perhaps the child has a tongue tie. So please explain to people what a tongue tie is and how do they go about identifying it and also getting help for their kids to sort it out. And also, is there something called a mouth tie or a lip tie, or is it the same thing?
Okay. First of all, I don't know what a mouth tie is. I've never heard of it before. But if a child has a tongue tie, you will see they will struggle to poke out their tongue. They'll struggle to poke it into their cheeks, over their teeth, and towards their nose. If a child has a tongue tie, then you should definitely go to a doctor, dentist. But they will definitely cut their tongue tie. So what a tongue tie is that there's a ligament between our tongue, bottom tongue, and the bottom of our mouth that holds our tongue down. That ligament is longer in children who have tongue ties. Who have tongue ties. So if we identify a child who has a tongue tie, speech therapist, then the speech therapist or doctor will refer to a dentist for it to be cut. Post that, they still have to attend speech therapy so they can fix the articulation problems.
Is it ever too early or too late to have the tongue tie cut?
Well, I think that will depend, and that's something that the dentist would establish, not so much the speech therapist. You know.
Okay.
Yeah.
And then next thing, and I think I've received also, because I asked some of my audience to give me questions that they might be concerned about, and this is also one of the questions I personally wanted to ask, because AJ was using a pacifier for the longest of times. He got weaned off the pacifier when he turned, I think, 2. Was it 2? Or maybe much earlier than that.
Okay.
But I eventually weaned him off the pacifier. Can a pacifier cause a speech delay in children? And what would you advise parents in terms of pacifiers, when to stop them?
So pacifiers, much like thumb sucking, can be detrimental to the structural parts of your mouth, which will cause speech difficulties, poor intelligibility. With pacifiers are grouped age-wise. So when your child passes a certain age, they use a pacifier that's different from what they would use if they were younger. It's important to maintain using a pacifier, to continue to use it within the age range that it's meant for, because once you let a child use a pacifier that's too young for them or that's too old for them, then it damages the structural part of their mouth, and then that's when they start having articulation issues. Not so much a speech delay, but an articulation issue, yeah.
Okay. My next question is, how important is it for parents to articulate... My next question is, how important is it for parents to encourage speech and language development in their kids? Is it ever too early or too late to start? And what are some of the examples you can give to parents to encourage their children to speak better or to have better speech?
Okay, so it's never too early or too late to stimulate your child. It's absolutely best to stimulate them as soon as you possibly can. The best way to stimulate your child is to read to them. This is even researched to say that even if you read to them while they're in utero, while you're still pregnant, they react to it. So the moment you give birth, bedtime stories are number 1, I plus. Another thing is that when you stimulate your child, say for instance you're reading a book. Don't overload them with information. Read a small passage and let them absorb it. When you read to them, make sure that you give them opportunity to interact with the book. This is just an example. And then another important thing is when you speak, children learn from an example. They don't learn from...
Yes.
So you make sure that you speak the way that you want your child to speak.
So no baby talk.
No baby talk.
I don't believe in baby talk, just by the way. I feel children need to be spoken to the way adults speak. Because when you start speaking baby language to them, they think that's the way you're meant to pronounce and say certain words.
Exactly. And then it's hard to take the child out of that because now I've learned that water is wawa. Wawa king. There's no water. That's not water. So you need to teach them the right way the first time so that they don't have to keep relearning. Yeah.
Is there other ways that children can be stimulated besides reading and speaking properly with them?
Toys. I think another thing that I encourage my clients to do is routine. Routine helps you build language quicker because you can establish between day and night. You know what happens between the difference between day and night. Then you can say when it's at night, okay, at night I want food. What kind of food do we eat at night? Then a child is able to grasp concepts better when there's a routine. Not a strict routine, but like they know that...
Some sort of structure.
Yes. So in the morning they know we have breakfast. They're able to conceptualize what life is like with a routine, which helps with development, not even just language development, with overall development. Yeah.
And then is there an issue with screen time? I think every parent would like to know this because this is a very controversial one.
Yeah.
There's people who believe that kids are not made for screen time. They need to go outside and play. There's other parents who will give screen time for a certain amount of time in the day, and then there's parents who just leave their children to be on the iPad or watch TV endlessly. So what's your take on screen time, and what would you advise when it comes to screen time and speech and language development?
Okay, I'll just start by saying research is also not like one way about it.
It's not the Bible.
No, not even that it's not the Bible, but like there isn't a certain rule that we follow. Different professionals have different viewpoints. Like optometrists will tell you limited to so much time because of their vision, and an audiologist, for example, will tell you to limit it because of the noise as well. But with regards to language stimulation, in my opinion, some parents are not even able to stimulate their children, and screen time is what helps them stimulate the children. The best way for me, I think, is that a child should have balance. As much as they use screen time, they should also play with like actual toys and interact with people. The important thing is to balance it out. Not so much that if it's 2 hours, then it's 6 hours, but to make sure that your child is well stimulated, not just with screen time. Yes, personally, I think it's great. Just don't do it all the time. Use other methods of stimulation as well. Yeah.
And should parents be specific when it comes to screen time? Like, should I be letting AJ watch specific shows, or any show that is child friendly is okay? Like, how can we use screen time as a form of education and stimulation, as opposed to just letting them watch whatever? Is that important?
First off, your child should be watching shows that you've screened before, to ensure that the content is child-friendly and is what you want your child to watch. It's very important that children consume content that you approve of, that you've screened before they started watching. It's important that a child watches content that is valuable for them, because otherwise it's just screen time and it's just a waste of time as well. Age-wise, we have to be very, very careful what our children are exposed to. You don't want your child to be exposed to things that they're not meant to be watching. You should be able to have controls that ensure that your child can continue to watch the content that you only approve of. And other than that, I think it's good. It's actually good, yeah.
So screen time is to some extent beneficial to language and speech development. Because recently also, I was on TikTok and I saw a parent mentioning that, I don't know if you know a show called Miss Rachel, that it's good. It's actually a YouTube channel where this lady educates. So she's got like a preschool where she'll do different interactive activities with the children. And she mentioned that her child was speaking a lot more ever since the child started watching Miss Rachel. So I started making AJ watch Miss Rachel, and I've seen like the impact that it's had on his
Yeah.
speech, because he's speaking a lot more. He's interacting with the lady on the TV as opposed to just sitting and watching TV, because they do have cues where they allow the kid to speak back. And I've seen how that specific or particular show has really helped a lot in his speech and language development. So yeah, I guess what Rakgadi is trying to say is too much screen time is obviously not good. Like anything, I don't think too much of anything is good for anyone.
Yeah.
But if your child is watching TV, then make sure that you know what they're watching and make sure that whatever they're watching is adding value to their speech and their development.
Absolutely.
Next, okay, my next question is, as parents, I think I'm guilty as well. We can be very quick to diagnose or mislabel our kids or even other people's kids. What are the dangers of this, and how should we guard against it?
Firstly, if you mislabel your child or misdiagnose your own child, then you will not stimulate them the way they're supposed to. You will not give them what they need. You will give them what you want to give them. If you think your child is going through something, if you suspect something is wrong with your child, consult your doctor. Consult a speech therapist, an occupational therapist, a health professional. They'll lead you in the right direction. Do not do it. Leave other people's children alone. Leave them alone, please.
Yes.
I'm not saying it's fine to mislabel your own child, but when it comes to other people, do not do
And
it.
I don't think it's even from a
topic.
bad place. I think it's often, like I said in the beginning, we as parents, you get concerned.
Yeah.
And it's so easy. And because we are a Google generation, it's so easy to start reading up a lot. And it's so easy to say, oh, my child might have this, or my child has this. And even when you start seeing those signs in other people's kids, it's easy to be like, yo, maybe this child has this or that or whatever thing that you read up on. And it can be dangerous or detrimental to the child, because then they, like you said, you end up not stimulating them the way they need to be stimulated, or you understimulate them because you believe that they can't be helped.
Yes. So the biggest thing is if you suspect something, contact a health professional. They will lead you in the right direction. Do not mislabel other people's children. Like, don't do that. Don't do that. No.
Okay. And then when should parents actually be concerned? Because I know we say children develop at different ages, or they'll reach certain milestones. Or for example, you said to me, AJ is actually doing quite well for his age, because AJ is only 2.5 months now. And you said he's actually doing well for his age. But at what age do parents start getting concerned and saying, actually, I think something is really wrong with my child?
So it depends really what you are concerned about. But like I'm saying, as soon as you are concerned about something, visit a doctor, a nurse, therapist, anyone. They will help you. You can't sit and just think it's never too early to suspect anything. If you feel like your child is not speaking when they're supposed to, sitting when they're supposed to, there's absolutely nothing wrong with going to a doctor or a therapist, a speech therapist, and they tell you, no, actually, your child is fine, but you can stimulate them like this to maintain their development. There's nothing wrong with it.
And what about parents who cannot afford a speech therapist or a language therapist? Is there access to these services in a government hospital?
Absolutely. There are speech therapists, physiotherapists, occupational therapists at most government facilities, hospitals that is. If you find that you are not able to see them in private, then you can absolutely go see them at government facilities, definitely.
Okay. So there's a few questions that some of my followers asked me, and I'm just going to read some of the questions to you, and I hope you can maybe answer some of them. Cool. The first question, this is a funny one. What are the key traits of an exceptional speech therapist?
I think, sure. This is also, wait, can I please just say, is this in government, in public? What is a good therapist, speech therapist?
Like in terms of what is a good therapist, I feel maybe what the parent needs to know is, how do I know I'm at the
yes,
right...
that's what I'm trying to
How do I
say.
know I'm seeing the right speech therapist and that this person is adding value to my child's development? So maybe let's rather put it that way. As a parent, if my child is having a speech delay or a language delay issue, how do I know that I'm seeing, or we are seeing, the right speech therapist who is putting my child's best interest at heart and helping or aiding their development?
It's a difficult question.
Is it hard?
I'm trying to think of bad therapists.
Really? You think there's no bad therapist?
No, there is, definitely. I'm trying to think what's
Same
wrong
way,
with
I
that
don't think
lady.
everyone has the best experiences with doctors.
No.
And surely there's some sort of standard or preference, and that's why even if I'm looking for a gynae, I will look for specific things in a gynae.
Let's go. Yeah, let's go.
Yeah, answer.
So I think what the key things that you will experience with a good therapist is a therapist who will build good rapport with your child, who is very attentive to your child's needs and who's able to also attend to what your concerns are. A good speech therapist will not just get there and start assessing based on what they think is potentially wrong with your child, but they will address what your concerns are, what the child's maybe weaknesses are, and then move from there as opposed to starting wherever.
So they're not going to generalize your child. They're going to be they're very case to case specific and address your child's needs as opposed to just looking at your child overall and pitting them against other children.
Yes.
Okay, I think I get that. And then, I don't know what grommets are, but someone is asking, how soon after installation of grommets does one expect a toddler to speak?
To simplify it, a grommet is a vent that's put through your through your tympanic membrane to help relieve infection. So what would
infection were in the ear?
In the middle ear, yes. So the reason why they would put a vent on the tympanic membrane is to relieve the fluid that's stuck in the middle ear that hasn't been able to come out through oral antibiotics. Also, if a child has had grommets, we have to establish first if they had some form of hearing loss before they inserted the grommets versus now. A hearing loss can affect speech development. If you can't hear anything, there's no way you can output anything. So she has to know if a child had a hearing loss before or if she has a hearing loss now to establish if it's too soon or too late for them to be speaking.
Okay. And then, how can one distinguish between a normal late talker versus a speech development issue? I think that's a good one.
That is a great question. The biggest thing is you have to, like I said, go to your health professionals. The thing is,
do you think we're not utilizing our health professionals?
You guys are
enough?
not.
Is that what you're trying to say?
You guys are not. So if you are concerned, go to your health professional. Consult a health professional. But in the same breath, you have to also assess your family history. How many languages my child is learning? How is my child being stimulated? By who and how often? You need to just establish if your child is getting enough stimulation. How is the stimulation happening? And but
you speak a lot about stimulation. Maybe let's recap. What are some of the ways we can stimulate our kids? So you're saying a lack of stimulation can affect a child's speech. So maybe let's recap. What are some of the ways? Sorry? Language or not speech.
Yes,
language.
Yes.
So what are some of the ways that we can stimulate our kids? I know we've touched on it briefly, but just to recap it so that everything flows and people understand better, how can you stimulate your child?
So language, we read. Reading, you correct what they say. You encourage grown-up language. You no baby talk. No baby talk. Also, another actually great way to stimulate a child is if you feel like they're speaking late, you can encourage them by speaking by not denying them their needs, but withholding their needs until they try and repeat
what they want.
Yes.
Okay.
So if they need water and they point instead of verbal speech, and you're like, here's the water, but what is it? This is water. You tell them, this is water.
Yes.
Repeat, this is water. If they say this is water, then you're able to give them. But you do not wait for them to say water. If they attempt to say water, then you give them what they need. That's also a great way.
But what if the child is getting frustrated?
Well, then you assess.
Oh, those are some of the early signs that you can see. Okay, something might be wrong.
No, not necessarily.
Repetition would obviously.
Yes, but you try to make them repeat. That's also a great way to stimulate language. But if a child is getting like restless or they're not too happy about you making them repeat before you give them water, then you give them water and wait for the next time.
Okay.
We're not going to put a time frame to say my child should be saying water in 2 weeks time. No. You just try when you can, and when you can't, don't push it.
Okay. Yeah. So if we can recap that, so it's reading for your child, speaking normal language with your child. I know one other one you mentioned earlier was toys, stimulate them through toys, and then also withholding certain things that gratify them in order to allow them to speak, but don't force them. If they're not doing it, try again the next time. And over time, you can then start to assess that, there's improvement or there's no improvement.
But go to your health professionals.
Go to your health professionals, guys. Okay, next question. I know earlier on you mentioned that at the age of 4 or 5, that's when a child can proper articulate themselves. Not perfectly articulate themselves, but you expect them to be able to articulate themselves. So this question, someone is asking, at what age should you expect your child to speak clearly? So at what, I'll rephrase the question for them. At what age is it concerning that a child is not speaking clearly?
Articulating yourself clearly could mean a lot of things. It could mean that you can't say it in Xhosa, or you're struggling to say the r in English. The way we develop speech is that not everything happens at once. For instance, we develop the consonant R at a much later stage as opposed to and p. So you have to ask, honestly guys, just go to health professionals. Honestly, see your health professionals. But also, if your child is like 5, 6 and they're still struggling to say like really basic consonants and vowels, then you should definitely like
see a professional.
Yeah.
Okay. Also, how do you get, because a lot of parents, I'm sure, myself included, have kids who struggle with the letter R. How can we help our kids get it right?
Okay, so with AJ, we expect the R to develop much later. So he's 2.5 years old now. What we can do is we can slowly bombard him with the sound R. We start with R in the initial position, in the medial, and then at final position, so that we can get...
Please explain that for someone who doesn't know, because obviously you've explained it to me. So,
Okay, cool. So we have R in the initial position, which means words like rabbit, rose. Those are initial positions. But also, when you're stimulating a child, then you stimulate them in context. So we're going to say Little Red Riding Hood. We're going to read Little Red Riding Hood. What is that? Red Riding Hood. We try and stimulate them to say words that start with the letter R. And then we we do not stop. We take over from the initial position to the medial position, which is words like arm. The R is in the middle.
Yes.
This also works with how we pronounce the different R's. The different R's, we trill different R's, we say them differently, but we want them to be stimulated with that specific sound in the different positions it appears in. And then finally we can have words that end with the letter R, like, I can't think of one now, flower,
Yes.
Flower. Then you stimulate the last consonant of the word. Yeah, so basically that's how we do it.
Okay.
Slowly bombard him.
Okay, and I'm glad you've given me. So guys, Rakgadi has these stimulation boxes that she puts together for children. She's put one together for AJ, which is really lovely because AJ does struggle with the R sound. So she's put together little cue cards that have words that start with a R, that have R in the middle, and that end with R. So if you do want these stimulation boxes, or you want to get one for your child, then you're welcome to put it in the comment section, or I'll actually put her contact details in the description box, and you guys can reach out to her for any boxes. She'll let you know how much they cost. She's got different packages for the different boxes. And then another question is, my daughter is 2 years and 1 month and can only say a few words, like literally less than 20 words. Should I be concerned?
No.
That's what you said to me.
No.
Okay. Does speaking 2 languages at home result in delay, in proper speech, in delay of proper speech?
I'd say it depends on the languages and how often the child is being stimulated in the one language versus the other language. So yes, it's possible, and this is the child still just trying to absorb all the language for them to be able to output it. Be patient with the children.
Must we be patient with our children?
Be patient, but if you have concerns, see a health professional.
Is it normal for a 7-year-old to still fail with sentence construction and speak properly?
No.
It's not normal.
No, I'd be concerned.
Okay.
Yeah.
My son turned 2. He follows instructions but does not speak sentences as yet. Should I worry? I don't know if that includes words at 2 years old.
Well, so the way we learn language is that we have to receive it first. We have to understand it first. So the fact that the child is able to follow instructions is a bonus. That's
It's a good sign.
Yeah, that's a good sign. If she's really concerned that he's not producing any language, then yes, she should see someone, a speech therapist.
Okay. My daughter completely lost words at 18 months. She's now 2 and still nothing. What could be the cause? So I'm assuming the daughter could say words and then completely lost it and is still not speaking. This is at 2 years old now.
I would see my health professional. I'd consult with a health professional.
Do you know what the possible causes could be? Is there children? Do you find that there's children who speak? I think in autism there might be signs of that.
That is a red flag for autism. Yeah.
Okay. This one says, my nephew is 4 in 3 months and doesn't speak yet, just makes sounds. Is that concerning?
Yes. That could indicate a speech delay and not speech disorder. I would consult with a speech therapist as soon as possible.
Okay. Is it too late for my teenager to speak properly if we overlooked speech problems when he was a toddler?
It depends what type of speech problems there are. Some children, like some dialects of certain languages, don't have certain sounds, so like they can't say properly, or they don't say the as other languages do not properly. It depends on what the articulation area is or articulation issues are. But if the child is a teenager and they have problems with articulation, they can still see a speech therapist.
So it's never too late.
No.
Okay. How can I help my 3-year-old who is stuttering? And I think there'd be a few more parents who would have that issue as well.
So with stuttering, then, honestly speaking, you'd have to see a speech therapist for them to give you a personalized home program and therapy.
Really?
Yeah.
So there isn't any home thing or anything you can do at home to help with stuttering.
The thing
because sometimes maybe it's caused by being nervous, and then there's like coping. Isn't there any coping mechanisms that parents could use to help or assist their kids, or would a speech therapist need to assess the child first to see what the cause of the stuttering is and then provide a solution?
Yeah, so some stuttering is hereditary and some stuttering is acquired, and depending on what caused it and how it presents, the speech therapist would have to assess and give an intervention plan.
Okay. Yeah. My little one is 2 years and 6 months, doesn't speak, not even saying mama or daddy. Should I be worried? She hums every song.
She should see a speech therapist.
Yeah. So it's a concern.
Well, they have to assess to really say if it is a concern or what.
Yeah. Okay. I think some of these we've answered. Hey Didi, when should I worry? My son just turned 1 and he really hasn't said, I think it's the same question, mama or baba. If he does say it, it's in passing, not because he's saying it to me or his dad. And this child is 1.
I wouldn't be concerned. Okay. Not for now, anyway.
How can one improve baby speech at home? I can't afford a speech therapist. I think we've answered that one. Yeah. Repetitive as well.
So, but let me say, what I could do is for those people who cannot afford speech therapy, they can just pop me an email or WhatsApp, call me, and then I can try and make like toy lists for them, for their children. Okay. And then they will use those toys to stimulate their children, and I'll do that for free.
Okay. Yeah. Did you hear that, guys? She's being nice. So if you do have a little one who you're like concerned about and you either can't afford to take them to a speech therapist, or maybe let's say your time doesn't allow you to seek help at a government hospital, you can start off by reaching out to her and she'll put together a list of toys that you can use to help stimulate your child. And I think once you've tried that, then you'd need to really seek professional help.
Yeah.
Is it normal for kids to develop their speech only after 3 years? I think we've addressed that as well.
That would be delayed, yeah.
Yeah. Okay, and then my son is 3 years old and autistic. How do I help him speak or / say full sentences? He only utters some words.
How old did you say she was?
3.
3. I would really say you should see a speech therapist to establish what the child needs to be stimulated and to see what the child's strengths are, to work on those to help improve their communication, their verbal communication.
I know we spoke about autism earlier on, but maybe can you just explain the different spectrums for someone who doesn't know? Because
Sure. So it's a spectrum. It's actually called, autism is layman. So it's autistic spectrum disorder. Autistic spectrum disorder. It's a spectrum, which means if you belong anywhere on the spectrum, you could be high functioning or you could be low functioning. High functioning meaning you function as a normal person. Maybe you struggle with certain social skills. Low functioning could be that you struggle to be stimulated or you're consistently overstimulated. Wherever your child falls on that spectrum, it's still important for you to get a personalized intervention plan for communication to see what are their strengths, what can they do, and to basically just be able to take care of them as best as you can as they need.
So with autism, it's basically not a one-size-fits-all approach. Like, just because my child is autistic doesn't mean there's one formula or recipe to help them.
No.
Your child needs to be assessed individually, and a plan needs to be provided for your specific child.
The autistic people who have even gone to like mainstream schooling and they've made it, they're fine. Versus someone who really needs a special school. And there are different grades of special schools, but yeah, you have to really get assessed to pinpoint where on the spectrum the child is.
Okay. Next question is, okay, it's basically about stuttering and then tongue tie. Is it okay to teach a toddler 3 languages at once?
Yes.
Touched on that
Absolutely.
briefly. Okay. How can you best do it in such a way that it doesn't affect their speech or language?
So in my experience, I can't say it won't affect their speech development, but I would not discourage it.
Yeah.
No, like I would not discourage it at all. Like I encourage it fully. Like a multilingual mind is far better than a monolingual mind.
Okay.
And the earlier, the more native, like the more you're able to speak the most native language. So the earlier you learn these languages, the better in terms of fluency.
Yeah. What does it, I think we spoke about this as well. What does it mean when a child starts talking for a while and then stops after a few months? Already kind of touched on
I'd
that.
see a speech therapist to assess what's really going on. They can make the proper referrals if they need. Yeah.
But you did say it's a red flag for autism.
Yeah, but you don't want to scare people. Also, that's like saying.
But I think the problem with speech delays is that we more fearful than anything, and I think because we are fearful, it delays us in getting help for our kids.
Absolutely.
But the more informed we are about these things, the sooner we can help our children and maybe aid them in their development.
Yeah.
I don't know. Am I wrong?
Yes, but we can only say it is a red flag for something. We can't say for certain that it's gonna be autism. We can only say we are concerned that it could be something, not so much that it is.
So guys, don't automatically, after watching this video,
don't say we have.
Don't automatically think
autism.
my child has autism.
No.
Oh my gosh, no. I think seek professional help and get your child assessed. It's the only way you can be for certain that they have a certain speech delay or a specific impediment.
Yeah.
A lisp. What's a lisp again?
Lisp is a speech, is a structural, it's an articulation error.
Okay. How do you guys assist children with a lisp?
We do articulation therapy.
Oh, okay.
Yeah.
And then I think we're almost done. I think we've gotten through all the questions, or most. I didn't go through all the questions, but most of them are quite similar.
Yeah.
But yeah, do you have any closing remarks for people who are concerned? I'm guessing you're going to tell them to see a professional.
Yes, but also I think as a mother, not to say that you're comparing your children or anything, but as a mother, if a child is not doing as well as they should. And it's okay to be concerned. You are the parent. Sorry, not to say the mother. Like, obviously, mom and dad. But
Yes.
like, as soon as you feel like a tinge of concern or suspicion of something, go see a health professional. They will help lead your fear in the right direction. Whether it's to help your child or to tell you that it's actually nothing. Don't be scared. Don't be scared. The longer you delay it, not the harder it will be, but like the longer it will take to help your child. So the quicker you do it, the better. Absolutely.
Okay. And then how can people reach you?
So I have a practice in Pretoria, Nuku Speech, Language Therapy and Audiology Services. You are more than welcome to pop me an email at info@nukospeechandaudio.co.za. Call me at 081 8800 987. I have an alternative number, 072 592 0365. That's where you can catch me. And if we are in therapy or in a session and it's something that I can't do, it's out of my scope of practice, or I feel like you'll benefit from a different therapist, I'll refer you to someone who will do a better job.
All right. Thank you so much, guys, for watching this video. I will definitely be putting all of Rakgadi's details in the description box. I hope that you found this video to be insightful and that it at least addressed some of your concerns or issues. Let me know if you have any more questions in the comment section below. Let me know if this video was helpful, and please don't forget to like, comment, and subscribe.
Bye.
I'm just trying to give you something.